thing which comes in our mind is the hairline. I think a naturalness is far beyond hairline. It is about the whole procedure that it should look natural and it should behave natural. I do not have any conflict of interest. Now, no human inquiry can be called science unless it pursues its path through mathematical exposition and demonstrations, as said by Leonardo da Vinci. The hair transplant had moved on from having a simple hair on the head to about where you will not put any attention to the angles, to the the density or the plugginess, and to the frontotemporal angles and towards the temporal peaks, which are the main front images that you can see. And it has moved on from there to a much more natural and balanced looking hair transplant, which is undetectable to a human eye. So my motto is a cosmetic surgery, which hair transplant is visible to everyone, but it is not detectable to anyone. So you can actually see it, but you can't detect it. Now, what gives naturalness? Now, in this patient, you can see, although the hairline seems to be pretty good, it is not looking a very natural looking hair transplant. So what are the factors that are missing? Now, this was type 7, which I have done 2 sessions, and I'll show you later on what was missing in it, as compared to another type 7, where you can see some naturalness, and you can see why it is more balanced looking and more natural looking hair transplant, although both of them are not really dense looking hair transplant. Hair transplant doesn't have to be dense, although density is one of the factors that we will discuss in a minute. So when I'm talking about naturalness in hair transplant, I'm talking about these 5 main points. The foremost is the framing of the face. The second is the hairline. The third is the angle of exit, which gives 2 important things. Number 1, it gives softness to the first look. Number 2, it gives the shingling effect, which actually gives the denser illusion towards the hair transplant. The fourth thing is angle of curvature, and the angle of curvature is mainly important in 3 important things. Number 1, the frontotemporal angle, the temporal peak creation, and sometimes giving you that puffed up look, which if you want to do a back combing, it will come forward and then go up, just like Elvis Presley's hairstyle. And the last but not the least is the density. So the denser it is, the more natural it looks. The ancient Greeks maintained that all beauty resides in mathematical relationships. So if you do not have these mathematics in your cosmetics, you won't get the required results. So what are the goals for designing an ideal hairline? It is a mature sort of hairline which will match the person's individual facial features and will restore symmetry, harmony, and proportions to the face. And the ideal hairline will always stand the test of the time and would look for the light. So how are we going to create? We need so many other factors to do it. The most important thing is you have to take certain measurements in your drawing, and that is the height of calvarium, that is the forehead inclination, the deeper nasal roots, nasal bridge, nasal tip angle, mentocervical angle, and craniofacial height proportionate to the width. So all those things, if you keep in mind while drawing the hairline, it will balance your face. So the balancing of the face is the most important thing. In order to balance the face, the most important thing is the frontal midpoint, how you're going to select that thing. And it changes from all those parameters that we have recently discussed. So it changes. It can sometimes go flatter, sometimes it go like an oval, sometimes it go different. So you need to keep on moving this frontal midpoint up and down according to the shape of the head, which is oval or round, and that is how you will do. Fine. In this patient, if you see the right? You can see that the hairline where I've drawn is above the trachea, right? So that is the area from where the hair starts going up. So above that towards the vertex is, is a cranium. So it is the forehead and the cranium. You need to differentiate that thing because that will make it a little bit more. It's a small little point, but it will balance it out, and I'll show you in later on that how it balances out. So for placing the frontal point, your facial height, which is measured from glabella to chin, and this ranges normally from 13 to 15 centimeters. So basically from glabella to the chin, this is where the facial height is, and the calvarium height is measured from trachea towards the vertex, which is normally between 3 to 5 centimeters. And that is where you want to balance it out. Half of the facial height and 1/4 of the calvarium height is used to place the frontal midpoint. Now, this is what science tells us, but sometimes you have to deviate from it, right? Sorry. Okay. So in calvarium, and the height of calvarium, which is the height affects the facial shape. If calvarium height is less than 3 centimeters, the face would look round. So in this situation, the calvarium height is not factored into the question for placing frontal midpoint, and the hairlines will add more depth to restore the hair. So how will we do it? Now, in this case, you can see that the height is too small. So this face, which is on your left side of the screen, looks more of a round thing. So in order to balance it out, you have to create in such a way that your face becomes much more balanced. So your face doesn't look like a round face. So that is how you will adjust for the height of calvarium. When some people will have a very wide forehead, so in such case, you have to make a more lower hairline so that you can balance the facial appearance. So similarly in Chinese, so you have to really sometimes bring it down. So in this thing, you can see that I have actually brought it down, and all these things are actually, by bringing it down into 1/3 each, I'm balancing it out. So actually, according to that, it was slightly bit higher than 4.5 centimeters when we were measuring. So you bring it down so that you balance the face. And instead of becoming, you can see that it is too wide over here. So the face is looking much more oval. By bringing it down, you balance the frame of the face. So frame of the face is very important. Forehead inclination. Some people have bossing. So in order to have the bossing, again, you have to drop the hairline relatively low. You don't have to really bring it down to 6 or 5 centimeters, but you bring it down normally where you would like in order to balance the face. Now, in this person, see how odd is this area. Now, I have normally, it will go probably slightly bit higher up, but I would just bring it down. So in order to bring it down, I'll have to bring the temporal peak forward. I have to make this hump. So from type 7, I'll have to do everything that needs to go towards type 5, type 6, type 5, type 4, wherever I can take it to. So that is how your face becomes a little bit more balanced. Now, in some cases where you have existing frontal forelock, you don't want to go behind it. You just start with the frontal forelock and you balance it out over there, right? So this will also give you a much more balanced looking face. So important is the framing of the face where we have to go. When it comes to the facial shape, we have got round, long, square, triangular. So you have to change accordingly as well, right? Exception proportionate faces, a relatively lower placement of the frontal midpoint with the result in the lower hairline helps to bring these faces into symmetry. Now, in Caucasians, you can see there is more width as opposed to that, normal like this. So Chinese will have little bit more width than the Caucasians. So if Caucasians, your width is 15.1. So from EU to EU, in Chinese, it will be 15.83. and in African American it is 14.4. So that is why most of the time in African you want to bring it down. Now, as most of the studies has been done in Caucasian patients, that's why most of the criteria that we read and study are based on Caucasian patients, not African American, not Chinese, not other ethnic origins. So different ethnic origins needs to have a slightly different way of addressing the nationalness, right? Now, the okay. Mukesh, okay. Designing the, can other people just mute their things? Okay. Designing the youthful, natural looking hairline. Again, how will we make a hairline now, right? So there are three important anatomical landmarks for the facial framing as well as designing hair: frontal midpoint, as we discussed, frontotemporal angle, and temporal peak. Now, most of the people, when they are trying to create the frontotemporal angle, they make it round. Now, they make it round because they are trying to compare it with 18, 19, 20, 22 years old, or those people who have never lost any recession. They have not even been type 1 hair loss. Otherwise, if you do have a type 1 or type 2 recession, it is never round. It is always angled. But you see, when you angle with a pen and when you angle with the graph, they are two different things. There should always be a little acute angle rather than rounding it off, because rounding it off, in my personal opinion, does not really look very natural. It looks more of a, unnatural thing if you see between the angled one and the round one. So this is from the Anger's book. So how you want to create these things, again, it's more of an angle. Most of the time from the frontal midpoint, it goes slightly bit up. And it's a very variable where you place your frontal midpoint. I generally place it between 7 and 7.5. Normally at 8 centimeters, you get that shingling effect where if you put your finger, it will sort of slips back. I think that's called a mature hairline. I always place it what I call lower mature hairline. So it is slightly bit lower than this vertical and horizontal axis. I always go a little bit low, and usually it corresponds with 7 centimeter from glabella or maximum 7.5 centimeters, even with type 7 or type 6 hair loss patients. And I'll show you how. Now, these are the apex, the inferior border of the angle, the superior of the angle, and the lateral epicondyle line, how you will create this hump. So if you're type 7, you have to create this hump. And in this book, and I'm sure in the 6th edition as well, Ron Shapiro has really nicely explained how you're going to create or where you're going to keep this frontotemporal angle. Now, what is an attractive hairline? It is that which pleases the eye. What is an objective attractiveness? What pleases most of the people? And what is a subjective analysis? What pleases you? So there is some science behind it, but there is also subjective likeness and dislikeness. And that is why what I said, instead of rounding it off, I subjectively like the ones which is not rounded off at the frontotemporal angle. Now, again, the frontal midpoint. These are some very important factors. That's why I take a little bit more time. So there are all different ways of doing it. When I am trying to do it, now see, in this, you will see the one is the upper transition zone, which is number 3. And then there is a mid-calvarium hair placement area, which is at that cross section. And then the lower transition zone, which is number 1, which is below that purple line. So I usually tend to keep at the lower transition zone, which is lower mature hairline, and should go around 7 to 7.5 centimeters. Now this is, gentleman was type 7, male pattern baldness, and I've brought it down to almost 7 centimeters. Right? So you can see that where the hairline placement is. The other important thing, in my opinion, is the balancing it. Now, most of the time you can use Dr. Pathomovich laser thing, But what I do is that I simply make the patient sit in front of the mirror. So once I've drawn the hairline, I make him sit in front of the mirror. So what I do is that what I saw is, you can see this area, there are two lines. My first line was higher up, my second line is lower down. So when I saw him from standing behind, so where my camera is, you can see in the mirror, the camera is there. So I actually stand there behind it and I see the patient in the mirror, and then I adjust it, because when I measure it from the eyebrow or from the mid eyebrow, from the lateral canthus, remember there could be bony changes. So if the underlying bone is different, or maybe one side is more prominent of the forehead is more prominent than the other side, now this change in the bony calvarium can give you an illusion of imbalance. So I have to correct that thing, and this is what myself and Ahmed have published as well. Right. The frontotemporal angle. Now, where you place it, a pretegral vertical line is drawn, just like what I was mentioning before, and the frontal midpoint is traced horizontally parallel to Frankfurt's horizontal line. Wherever this horizontal line meet with each other, so we basically place it over there. So if this lower one is the horizontal line, so there is a vertical line over there. So wherever this meets, so the upper part of that would be frontotemporal angle. So if I go along here, so this is where it is. So I'll make a hump over there. You can see some existing hump, and I'll bring from here right down towards in the center over here. So that is my angle would be, and then I'll try to create this temporal peak. We'll discuss that thing. This junction can move about 3 to 5 millimeter up or down, depending on how you, this junction from this place to this place will drop down between 3 to 5 millimeter, depending from person to person. Now, when you're creating the frontotemporal angle, one is the most important thing is the hair curvature, which I presented in 2005. And this frontotemporal angle is an area where the artistry of the surgeons comes into play. Now, one should make sure that you know how you are parting your hair or how you are styling your hair, because when you keep the curvature of shaft in the direction you want to create the fall of the hair, this will give you a very soft look and natural look. And how would you do it? Now, look at this person. I have really tried to, this is what I've tried to create. I've tried to make the temporal peaks, and I've created this drop down. He was type 3 sort of thing, or 2 or 3, something like that. Now, it has been done, but see what is happening is frontotemporal angle. Some of the hair are not behaving because the angle of exit was on one direction, but the curl wall on the other direction, so they would not behave properly. So it would be very obvious. So if you see this whole hairline, you can, your eyes will stop in this central part of it, right? And you will see that there's something wrong about it. What is that? It is about the curl of the hair. Now, what is the curl of the hair? See these hair, they are curling on this side. They are trying to go on this side, and the ones over here, they are trying to go on the other side. So when I saw this patient of mine, I thought, okay, fine, there must be something. See again, another this thing. You can see these hair going in separate direction than the rest of the hair. So you want to use those curls into your favor and put it in such a way that when you create a natural looking hair transplant, it should look much natural. And I'll come to this point when I'm going to explain the temporal peaks, and where I'm going to explain how I use the curl and how I shape the curl over there. Right. You can see over here things are getting wrong. The other important thing, the third point, is about something is missing. Now this person has got a really nice looking hairline, but he is not balanced out. So what is missing? The missing thing is temporal peaks. So you want to create temporal peaks in order to have a balancing to the face. Temporal peaks extends from the anterior part of the sideburn to join the frontal hairline at the outer canthal plane. and has about 4 centimeter peaks above the Frankfurt horizontal line, and the temporal hairline recedes backwards and downwards. You know all these things. So the temporal hairline can be restored by extending it upward with negative inclination to meet the frontal hairline at or in front of the pretracheal vertical line on outer canthal plane. So what you do is that you have got this frontal Frankfurt horizontal plane. You go about 5 centimeters above. That is more or less like, but it can vary from person to person, and also depends on how strong you want to create. If you are trying to create a weaker one, it might be above the this 5 centimeter or slightly bit above and below. So you can actually change it according to how strongly you are trying to create this frontal or temporal peaks. Now, this temporal peaks brings the balance back of the face, right? So now this is what I was creating. No attention to this is my one of the very early patients back in 2000, right? So I was not happy with how I was creating the temporal peaks. So now what I do is that I actually, although I'm not using any more of these blades, I'm using now cut to size blades, but they are angled. So I actually flush it with the skin. So it's horizontally placed, maybe 0 to 5 degrees or 0 to 10 degrees, as horizontal as I can be. And then the important thing is the upper part of ones are more horizontally coming down or obliquely coming down, and the lower part of them are placed more horizontally. If I'm trying to take this line as vertical and lower line as horizontal, so the lower ones are more horizontal along the line, and the upper ones are more oblique along the line. So then you create, you see, I'll always try to create this angle, never round it off. And then you create this thing. But see, why it's a good hair transplant. You can't see anything over here. It's a nice one, but there is something missing. Now, what is that missing? Look at these here. They are all curling back. And look at these here. They are all going straight down. So something is missing. And what is that, right? Sorry. I'm going to touch that thing in a minute. Now, when we are going for the hairline again, as I mentioned, these are very important. You want to make sure that they are not in a straight line. So when we come towards designing the hairline and mature hairline is there, we go towards, we think that single follicular unit will give us natural looking hair transplant. No, it won't. This is a typical example where all the singles were used, but you can see it's an irregular hairline. It is still a line. It is irregular, but it is still a line. You should not have a line effect. So, and I've always followed, when I'm creating a hair line, I've always followed Ron. And what he does is, he uses these small clusters. And the most important thing, in between these clusters, he used what he calls centennial hair. Now, these centennial hair are something like this one. This is a centennial hair. This is a centennial hair. So if you create these ones and you keep on creating the same thing, you will have a line effect as well. Until unless you bring these centennial hair in between, that will give you naturalness. So these will be micro irregularities, and then you will make those macro irregularities along, right? Even if you don't make those macro irregularities and your micro irregularities are really nice with these centennial hair, which is the most important thing in my opinion, then you create a very decent looking hair transplant, right? Or the hairline. The other thing, when we are trying to create a natural, is angle of exit. Now, you see, sometimes we don't have to follow the nature. When we are trying to follow the nature, it is when everything was there. But when things are not there, you have to sometimes do a little bit improvisation or cheating. Now, in that cheating, you have to create your own things, because when nature has given you 80 to 100 follicle units per square centimeters and you are limited with 30 to 40 follicle units per square centimeters, you can't have the same angle. You don't have the luxury of giving the same angle of exit. You have to bring it down because that will give you more softness. So look at these here. They are actually not going up. They are actually 20, around 15 to 30 degrees, not more than that. Whereas what people say you want to have between 15 to 30, and what I try to do is around between less than 15 degrees, as acute as I can. Look at these ones. Look at the ones over here. They're really going down, So that is how you will give that softness. You can see that these are centennial hair. This is the centennial hair over here. So that will give you a more naturalness, right? The other is now coming to that angle of curvature, which will give you more naturalness towards these two things. So you see, there is something called the skyline. Skyline is the area or the line where the mountains and the sky, they join each other. So any movement in the skyline is really visible to the person at a very long distance. So that is why when you are trying to cross that skyline in terms of battles, you want to crawl in that area. Otherwise, you will be detected just like that. So similarly, angle of curvature is very important when we are trying to create these, hairline, the frontotemporal angle, temporal peak, and how I'm going to show you. Look at this. When we dissect out, or when we take the FUEs or FUTs, you will see some of the hairs are straight, some of them have curves of different levels. So what you do is you mainly take these curved ones and you use them judiciously. And how you use them? You place them in this area. But look, it's going upwards. So what I want to do is I want to see this area. I want to curl them into a position where you can see that it is going like this. Just like this curl over here, when you see it over here. So you want to create the same curl over there. Then you put all these curls, the one on the top a little bit more, the one on the lower part a little bit more, upper part a little bit less, in order to create the same thing. And when you create this thing, so from here you go to like this. Now see, all these hair have got that curl. They are now just like any other curl of this person. So now you are creating the same curl as it is over here. That is what I call more naturalness. Similarly, when it comes to the frontotemporal triangle or that area, see again. Now all these hair are going on this side, they are going on this direction, and these ones are going up and in that direction. So in this frontotemporal angle, you don't see anything which looks unnatural. So that is why you want to create, and see all these centennial hair, they are all going down and giving that naturalness. Right. The third one is density. Very important. When you can give a density, you can really, it can look natural. But most of the time, we don't have the luxury of giving that much density of 60, 50, 60, 70 grafts, because we are dealing with type 6, type 7 male pattern baldness, where we have got a lot of limitation of the donor supply. So what do? We place strategically. We place the graft in such a way that we create an optical illusion. The optical illusion, because our donor area is limited as opposed to our density. Now, we know that the hair loss, by the time you lose hair 50%, you do not see any loss of the hair. So Bobby Limmer first took note of the average densities. that resulted from hair transplant, and his patient averaged 41 hairs per square centimeter hairs, not grafts. And subsequent sessions 50 to 60 to 81, but they were still lot less, which is about 200 or so per square centimeter than the usual donor areas. On the other hand, Manny Marek studied the illusion of coverage and hair removal. So would remove the hair, and what they saw is that even over 50% of the hair were plucked, the illusion of the density is still the same. So that gives us about, if you really want to give the same dense illusion, you don't have to go up to 60 or 70 grafts per square centimeters. You can even go 40% of that. That means if 80 is there, so you can go about 30, 35 grafts per square centimeters will give you a nice denser illusion. Now, again, with Dr. Kure, he has devised this coverage value of 6, which gives a good illusion. So that is for the donor area. So when you are harvesting, you calculate the number of grafts per square centimeters, number of hair per graft, multiplied by the diameter in millimeter, right? And then you see what is the coverage value. And he says that it should not be 6, right? The same thing when you are trying to remove it, so you want to make sure that it is removed in such a way that now when we are transplanting it, we can use the same thing, and instead of removing it, we are adding in such a way we are seeing what density and how many grafts with how many hair we are placing where. So that is where the strategic placing comes, and the coverage predictions can be there. So once enough hair is on the scalp, that light reflection is mainly through the hair, and this illusion of the coverage is achieved, right? And the illusion of so in other words, your skin should reflect minimum light. Maximum light should be reflected by the hair. So there comes the hair mass transfer index. Now, what is hair mass transfer index? It is the hair mass, right, which is transferred, and the assumed standard is 1 centimeter. So if we are trying to do a little bit more hair mass total in transfer index, then we want to see the actual length of the hair, because the longer hair will bring more cylindrical volume, right? And this is what John Cole has also mentioned. Now, when we are talking about type 5, type 6, now remember, hair transplant is not about type 5, type 3, and type 2 hair pattern, hair loss. We are talking about much advanced as well, right? Now, when we talk about advanced, I think a lot of things has changed. Initially, not many people were living to that age. Now, as the life expectancy is more, you can see more number of people going towards type 6 and type 7 as predicted earlier. So this is how, with only 2 sessions, you can create and strategic hair, you can create a much more denser illusion. Now, his total number of grafts is less than 30 per square centimeters, but see the illusion it is giving. And what happens is, now in this one, I am not doing any transplant on the left side, because the patient is going to do the parting of the hair from left to right. So what I'm doing is, I'm doing 100 grafts over here, 100 grafts in this all area, 100 grafts over there. Now this is not the frontal, but mid scalp area where I want to put little bit more grafts. So about 300 grafts, because this is the area where the light will travel from every side, from front to back, from side to side, from back to side. So I want to create little bit more density over here, and then slightly bit around it. But I'm not doing any transplantation on this right side, because the hair will flow from one side to another side. And this also was recently mentioned by Mary Schambach in Long Hair Preview. She has said that when I'm doing long hair preview, I've started to use lesser number of graphs. And I've been saying this thing for the last at least a decade or more. So when you create this illusion, you create much more density because you don't want to go anything over there. That is fine. So you want to only do a hair transplant in these areas where the skin is visible. So in my second session, by doing 1,000 grafts, I can simply give a much denser illusion. Now, between this and this, the number of grafts seems to look double. But actually, this one was about 3,000, 3,200. This is about 1,500 or 1,800 only, but it was more strategically placed. So what you want to do is you want to do a strategic placing of the grafts, right? Look at this. Hairstyling, another important thing that I'm going to discuss. So how you style your hair, all I've done is in the whole of the crown, I've done it 6, 7, 8, 9, 10, 11, 12, 13, 14 grafts. Nothing over here, just a little bit over here. And in 2 sessions, I've given him almost from front to back, almost 90% of the area is covered by strategically placed grafts. Look at this. I have mainly done the maximum of all this area. Almost this area has taken 50%. The rest of the whole area has taken 50%. So you want to create this area much more denser than the other one. Now he is not dense, but he is, same. In the second session, I will just go for the areas which are visible. And of course, the length as well, because the length does make a lot of difference. And one of the studies that me and Ahmed are doing is about the hair transfer index, how important it is based on the length of the hair. Now, again, I'm sorry, most of my papers are with Ahmed. He's my, he's my clever part of the clinic. So occipital hairline is another forgotten area. Now, it's not about creating that whirl. It's about giving single hair over there. So what we do is that most of the time we put singles on the front and doubles and triples on the back. So if you have not done this part of the it, which is crown, you will see 2s and 3s over here, and that would look unnatural. Now, in naturalness, you do have baldness over here. So sometimes this baldness is fine, but you will never see 2s and 3s over there. So the crown, if you're not doing it, your occipital hairline should be something like the frontal hairline. It should be only singles, not doubles and triples. And it should also have those centennial hairs. It should also have the same sort of thing. So it is very important to consider that until unless you are making this world and you are creating it. So someone like this, look at this. This is the same patient. I am just giving 200 grafts over here, about 100 over there, a little bit on the crown. See this. All this area is taking almost about 500 or 600 grafts. That's it. 200 grafts over there, 200 to 300 grafts over there. So this is how I strategically placed. And this is the same patient, and I saw it earlier, 2 sessions, and I'm giving him a nice full coverage with a good illusion, right? So one of the last points, especially in places where people are, doing bowing down or putting their head in their religious prayers or things like that, you tend to develop this small little marks. Now, this small little mark is called a prayer mark. If you are not taking care of it and avoiding it, go just above it, any hair that you're going to place it over there will, over the period of time, because of the friction, will go away. Then you will have a small little gap in your frontal hairline. So you want to make sure you go be above that area, prayers, right? And then this is how it is created in 2 sessions, probably hardly 4,000, 4,500 grafts, but see the density, right? See how I've gone above it. So sometimes even if though I would like to come over here in order to balance the frame, I went up because I had to bring this thing into, into making the hairline. So there are exceptions, right? So you want to make sure how you want to deal with those exceptions. And in my book, this is one of the exceptions where I will not follow my normal routine things. And once I do that thing, we can do everything. And with that, I really thank you all.
Wow. Excellent lecture, Dr. Humayun, as ever, and really very impressive. We learned so many things from today's lecture. Over to Irfan now.
Thank you very much. It was really a nice presentation, excellent one, and big hands. Dr. Humayun, you are excellent, seriously excellent. And I will ask anyone if you have some question, you can come up with the question, and we can directly ask Dr. Humayun.
Can I?
Assalamu alaikum, everyone. I just want two or three questions. One thing I am missing, that effects of buttocks on hairline. When you make a hairline down or up, a person get the buttocks. Like me, when I take the buttocks, my hairline goes about 1.5 centimeter above. What do you think about this, and what will be the criteria while we are designing? We will design the hairline. Either the person will take the buttocks, and what will be the effects on the hairline after taking the buttocks?
You see, if I want to understand well, you are trying to say how will I design a hairline, keeping in mind that later on the patient will use Botox for his crease, right? Right. Okay. I really do not think that Botox will let the hairline go up. It won't. It's basically for dynamic, it's for the dynamic wrinkles, right? It's not gonna pull your occipital muscles will not pull the head back. Yeah. If you're gonna do this thing, I don't think so. It will have a significant. It might have an impact of maybe a millimeter or so, which I really don't think so, or I've never noticed that. But I don't think that will have a significant impact. So I'll ignore the Botox. I'll just frame the face, and then we'll see how it goes.
In my case, personally, I feel when I take the Botox, my hairline go up approximately 1 centimeter above. It's my personal experience.
I would like to, fair enough, but 1 centimeter is too much. Trust me, 1 centimeter is a lot. I genuinely think maybe in your case, you might have some really strong muscles.
It's very loose. Maybe it's very loose, maybe.
I think maybe my experience is nothing in front of David, who is sitting there. So maybe he can help me out, or he can either endorse your thing and give some things. David, do you have any comment on that?
Well, I would actually have another comments related to your lecture. Excellent presentation. Congratulations, my friend. I think you gave a great review about not the frontal hairline and also the lateral hairline. And I just seen an article that I wrote with Dr. Mayer probably 17, 20 years ago about that thing. So, but congratulations to you. And I think important for your young members is that every patient is different as every surgeon. And we did at the Orlando meeting, you may recall that I have a patient with 10 surgeons and they mark different 10 hairlines. Why? Because every surgeon is different too. And there's nothing wrong with that. So that we need to learn, that we need to find your experience and training about the design of your hairline. Better go higher than lower, because it's going to be a big issue. And I always recommend my fellows I said we have three things that you need to keep in mind when you design your hair restoration. Number one is the hair loss. Number two is the patient, the budget. And number three is the donor. And I play always with those three. And sometimes I get, you mentioned 7 centimeters. Sometimes I go a little higher because it's a patient with good donor, too much hair loss, but no budget. So we need to play with all these options all the time. And again, you mentioned very well to include the temporal peaks when we plan our surgical hair restoration. And also one more thing is with Dr. Levitt, we work and design the cross-hatching. As you may remember, Humayun, probably that's the only one that have been with us. So it's a just mix your recipient site creation in different angle and direction that give you dilution or more hair and more density. It's in some cases, not all the cases, obviously, but again, I think the angle, the direction, and tilt are important. And not worry too much about the amount of graft that you're going to place. It's not that thing, it's got the art. How you're going to plan the surgery. That's the most important thing. So, sorry, that's some of the comments, and congratulations.
Humayun, can you show me the slide of the crown pictures again, please?
Okay.
Crown.
That was taken from the book, but I'll show you. That's not a problem. I'll show you back.
I have recordings. Yes, you can.
That's the question for me from you, Humayun, about the crown.
Yes, crown picture. Before back,
Okay.
back, more back. No, the this one. Yes.
You're talking.
This.
Okay. This one. This one.
World. Yes. World Center. VTP World Center. Yes, it's a very good picture. You told us only the single follicular hair will transplanted in this area, not the double, not the triple.
No. What I was mentioning, when I'm doing, you see, there are two things. If I'm creating this crown, that's a separate thing, right? But sometimes what I was mentioning about was this paper, which is occipital hairline. Now, occipital hairline, what I mean is this line. If I'm not creating the crown, then this hairline should not be visible, means there shouldn't be any dull appearance over here as well. So these hair, if you are not creating the whorl, these hair should also be single. But if you are creating this one, then your single one, these ones which are in the main one, these should be the single, and then you come towards doubles and triples over here, so that anything which is visible to the eye should be single hair. Anything which is covered by the hair can be twos and threes, which can create that density. So from my point of view, either these hair are the occipital hairline, or this hair is the occipital hairline. You can see the arrow. Can you see this arrow? This occipital light blue color is the occipital hairline. So make sure that these are single hair, or anything which is at the edges should be single hair. So your eyes should not detect two hairs. So that is what I wanted to say.
Yeah.
Is that okay?
Can we use the chest hair on this area?
Yes, you can use chest hair, but again, if you want to chest hair, your chest hair should go into this lilac or purple color. This is where chest hair, this hairline should be your, you see, your crown should not only be chest hair or beard hair. Your beard hair, chest hair should be in combination with your scalp hair. So if you have got 100 scalp hair, you can, in between them, you can put 200 or 300 other ones. So your flow of the hair should be because of your scalp hair, and your filling up should be because of your chest hair or your beard hair. This is what I would like to say in order to create the crown area. So that is what I wanted to show.
And also, can I make a comment, Humayun?
Yes, please.
Yeah, but also we have two options most of the times when we approach the crown. Number one, it's working from the periphery. If we don't have too many grafts, if we want just to reduce the size of the crown, we can go from the periphery to the center. And sometimes it depends, we don't touch exactly the world. We just touch the periphery to do smaller from here, to do a smaller, but still you have hair loss here. That's one option. The other option could be, the other option could be just go.
What you are trying to say is, what you are trying to say is, we don't have to make this thing. We can just simply add this greens ones over here, right? And if greens one can extend till here, so you will have a bigger crown. So let me go back. Let me go one slide back, or let me do this thing, right? So in other words, we can create a hair. Sorry, the same one was better, right? So in other words, making this whirl is not necessary, and I agree with you. And that is where my paper between me and Ahmed, we were saying that occipital hairline. Occipital hairline is the hairline. If I'm trying to create only this area, not the whirl area, these hair, which is visible to the naked eye, should be single hair, not double hair. So my point is, your occipital, just like what you have mentioned, I don't have to make the whirl in the center, but whatever I'm doing, the visible area should have single hair, not twos and threes. You understand what I'm saying?
Mm-hmm. Correct.
Yes, exactly, Dr. Humayun, exactly. This is the point which make the difference.
Thank you very much. If anybody else, I would, before going for another question, I would like to thank Dr. Stephen Gabel, Dr. Alba, Dr. Ammar Jafri, who are giving some time out of their practice. They are like busy in different parts of world, and thank you very much for joining us. And if any other question, if somebody is interested to ask question, please.
Sir, I want to ask a question. I'm Dr.
Yes,
Waqar. Sir Humayun, it was a very nice presentation and it was a great honor to listen to you. Sir, I want to ask the question that during the presentation you said that you now, after too much experience, you started using different blades. So I have started this practice from last 2 years, so I have not too much experience, but I want to know, sir, which blades are good for, particularly for making a good hairline and making a dense hairline, having 2000 grafts in the hairline. So which blades, sir, you recommend specifically, SP90 or something different?
Look, you see, you need to understand the concept behind it. Tools are secondary. Concept is the primary thing. Your concept is that you want to create 2000 grafts in hairline. Now, hairline, if you read, let's say, either Jeffrey Epstein or you read or hear Ron Shapiro, he talks about the transition zone and then the actual denser zone or the true hairline, right? I don't know why I would put so many grafts in a small area. You want to create an illusion, because if the person is, let's say, in his early 30s and he is type 3 and you are creating that hairline, denser hairline, then you need to understand, just like David has mentioned, where will he end up? So you need to really see where he would end up, and you have to base your surgeries based on that. Now, if you are creating the hairline, there are people who are using 0.7, 0.6, 0.5, straight or coronal sagittal. Everybody can create a wonderful hairline depending on what they are using. Even 1.3 mm, which is a very big, you can create a very nice and dense looking hairline. So you can, when you're creating the hairline, your first line should be singles. Your second line should be singles and doubles. Your third line should be singles, doubles, and triples. So gradually, and then onwards, you can be double and triple, so that you create the illusion of density behind the first couple of lines. In that way, you will have the naturalness or slow progression from the bald head to a denser hair. So that is called the transition phase. It should not be more than a centimeter or half a centimeter, and then you go towards density. So it's not about what blades are you using, how you are using those blades and how you are using your grafts is more important than what you are using. So it's not about what you are using, it's how you are using those things will make you a different surgeon than the other surgeons. So try to understand the conceptual understanding of how you can create a true density or a visual density. They are two different things. Visual density is not true density. You're just creating the visual density by making sure that the light reflection is more from the hair and less from the skin. So again, lights and shades. So you want to create all those things. So yes, with the passage of time, you will learn and you will become more wiser and you will become better than us.
Thank you very much. And
also,
David, you have a question, please.
yeah, just one comment. I think is Dr. Wahar make a very good comment about too many grafts in the hairline or the front. So when you are young, you want to make a big density all the time in that particular area. But when you get experience, you know that the numbers, you need to be very careful, especially as a young patient. Young patient with this not medical treatment. So you need to think for the future and discuss with your patient that sometimes more numbers, it doesn't mean better results. It's all what I said. More graph, it doesn't mean better results. We need to be wisely about the plan and talk with the patient. And I think we all were having the same like you are, Dr. Wahar, but the experience gives you more opportunities for more options to your patients and not all at once, you know? Be careful and think for the future too.
That is very nice advice. And I would like to ask Dr. Mogis and Dr. Varis to take over and give your comments. Dr. Varis is General Secretary of our society and Dr. Mogis is President of this society. And I would like to ask them to give their comments.
Okay, I just want to congratulate Dr. Humayun. It was a wonderful and fantastic explanation of very tricky and difficult aspects of hairline. I just would like to comment on Dr. Vakas was asking for the density of the hairline. More you are young, more you are enthusiastic, more you go for the density. And if patient demand for 1500 and you want to put 2000 to prove yourself that you are extraordinary, you are better than rest of the surgeons, you are very enthusiastic in young age. But as you are experienced, you try to play with those grafts. As you know, this is the asset of the patient, which is not too much. It's actually the weapons with which you can play in future. So you always try to conserve your weapon for the future war of the baldness. So as Dr. Humayun mentioned, as you get experienced, you are more wise to use those weapons more wisely. So it was actually wonderful explanation of hairline and natural hair restoration. I really appreciate it. It was wonderful.
Dr. Humayun, thank you very much. And Dr. Humayun was our past president, and he is our, David, we call him our Baba of Pakistani hair restoration surgery. He was one of the pioneers who started hair transplant in Pakistan. And Dr. Humayun, an excellent talk. And we, really enjoyed your lecture. And definitely, as everybody else said, that we all learn through experience. And we HRSP, Hair Restoration Surgery of Pakistan, we are trying to collect all the experienced people like David, like Stephen Gabriel, and all the Amar Jafri on this forum. And they should all teach us what they have learned from their experiences, so that the younger lot, they should not try to struggle in experimenting. They should learn from the experience of our elderly, of the senior people who have experimented everything, and now they are, came to a conclusion that it is not dentistry, it's an art, it is a science how to perform hair transplantation. And I'm really grateful to Irfan, Varis, and all of my team. They are amazing young people with me, and hopefully we will try to, make this forum a excellent educational forum for whole of the world. And thank you very much again.
Thank you very much. And Steve, if you are listening to me, get ready for next lecture in Jan, and I will be in contact with you on your email, and we will be having a lecture from you as well. And thank you very much, everybody. Vakar, you will send me your number, and I will add you to the associate members, and you will be there for lectures. And I have something for you, Doctor. I have some articles from David, and will share with you in forum like forum of HRSP and associate members. Thank you very much, everybody, and see you on 19th.
Thank you very much. Bye bye. Bye bye.
19th.
Bye. Thank you.
Thank you, David. Thank you.
Thank
Bye.
you.
Bye, everyone.
Thank you, Humayun. Good job, man. Thank you.
Thank you.
Dr. Mughis, I have noticed the use of word elderly for Dr. Humayun and myself, and I will remember that.
I was just trying to ignore it.
Anyway, a wonderful lecture. Thank you very much.
Thank you very much.